To have all of you here with me right here in Ottawa, West Nepean. And I'd like to invite everybody, welcome everybody to the Pinecrest Queensway Community Health Centre located right here in my riding. J'ai souvent dit que ma circonscription avait la rivière, la nature et la diversité. Et tout cela est tout à fait vrai à 2 pas d'ici. Même mon bureau de circonscription est 2 minutes d'ici. Cependant, nous ne sommes pas sans défi. C'est pourquoi, dans mon rôle de député, j'ai toujours fait l'appui aux populations vulnérables une priorité. And that's why I am so happy that we're here today. The Pinecrest Queensway Community Health Centre is truly community-based. This valuable organization meets the needs of different communities that call Ottawa home, helping those who face barriers to access or who are vulnerable and at risk. You help these families to achieve their true potential. And I can say, having been the MP here for 10 years, I have known so many people who have been serviced by PQ and then gone on and are now returning and helping others. And the work that you have done to lift so many people up, I don't think that it can even be measured. So thank you very much. And a big part of that is ensuring that these families can access the tax benefits and credits that they're entitled to, which is why I am very pleased to introduce my colleague, the Honourable Wayne Long, who has great news to share with us today. Over to you, Wayne.
Well, good afternoon, and thank you for allowing me to be in your great community health center today. You know, I often say places like this across the country, you don't just change lives, you save lives on a daily basis. So sincerely, to the volunteers, to the staff here, thank you for what you do. Just a few words about Anita Vandenbeld. We were both elected in 2015. Obviously, Ottawa, West Nepean, I'm St. John Rossay, now St. John Kennebecasis. And let me tell the people from Ottawa, West Nepean, there is no better advocate in our House of Commons. I obviously can't divulge what's said in caucus, but she is a strong voice. She is a passionate voice. And, you know, again, you couldn't have a better representative as your member of parliament. And, you know, I would sit at caucus sometimes and see Anita's interventions and be like, wow, she's focused, she's organized, thorough. So you're very, very fortunate. And I'm very, very fortunate to obviously have this wonderful role, and I'm very, very proud to be here today. So I am very proud to announce that through our past budget, Budget 2025, the Government of Canada has renewed the Community Volunteer Income Tax Program, the CVITP, as we all know it, grant for the next 3 years, starting with this tax season, the 2026 tax season. The CVITP is a program where free tax clinics are hosted by community organizations in various cities and towns throughout Canada. The services offered are available to individuals who have modest income and a simple tax situation. This announcement today touches on a few cornerstones of our new government. First, this is about affordability. This renewed funding was made possible through Budget 2025, the blueprint for Canada's new government's focus to make life more affordable for Canadians from coast to coast to coast. Our government understands what it means for millions of Canadians right across our great country to be able to access these vital services. It means that more money can go towards essentials, like putting food on your table, mortgage, rent payments, heating your home, and more. Last year alone, just think about this, more than 3,580 organizations and nearly 20,000 volunteers across this country filed over 1 million tax returns. 1 million tax returns, putting billions of dollars in benefits, credits, and refunds into the hands of individuals who need it the most. I can tell you, talking to MPs across our great country, All of us have stories about people coming in who hadn't filed their taxes, who need help filing their taxes, who hadn't received the GST credit or the Canada Child Benefit. And some of these people across the country, and those who are in need, sometimes are owed thousands and thousands of dollars. Second, this is about investing in our communities and building trust among Canadians. Canadians need to know that their government is able to help them when they need it the most. The renewed funding today is an example of how our government will always have Canadians' backs. Third, this is an excellent example of how well democracy works in Canada. Budget 2025 was formed through hundreds of consultations we had with thousands of Canadians, from Kelowna to St. John's, from Sudbury to St. John, New Brunswick. I can tell you firsthand, I was literally gone 50 out of 55 days this past summer, going coast to coast to coast to lead our pre-budget consultations. And we listen to Canadians. And we're going to continue to listen to Canadians to ensure that our policies and programs are always informed by their voices. This announcement builds on the work we've already done that also encompasses these cornerstones. The Automatic Federal Benefits Program that's certainly near and dear to our hearts, announced this past October, is another initiative that our government has taken to make life more affordable for up to 5.5 million Canadians. With that program, we're making it easier and faster for low-income Canadians to get the federal benefits they are entitled to, like the GST, HST tax credit, the Canada Child Benefit, the Canada Disability Benefit, and more. I want to take the opportunity to recognize all the organizations and volunteers who take part in the CVITP. I also want to congratulate CRA employees for their commitment to this initiative. Their efforts demonstrate the strength of collaboration between the CRA and community organizations in improving the lives of Canadians. This program is only possible thanks to the generosity of hard work of our volunteers. To all Canadians looking to make a difference in their communities, I encourage you to reach out to one of your local organizations offering these tax-free clinics and get involved. Volunteers do not need prior tax experience, although that's helpful. Training, software, and CRA support are there for those who need the support and the training. But what really matters is a willingness to lend a helping hand to fellow Canadians and a desire to support local communities. So as a government, led by our wonderful Prime Minister Carney, we are committed to Canadians, we are focused on delivering for Canadians, and we all believe that as a government we should be judged by how we look out for and support our most vulnerable. And the CVITP, is a perfect example of our outreach to make sure that we can offer Canadians a tax-free or a fee-free way to file your taxes. So thank you and good morning.
Well, thank you so much, Secretary of State Wayne, my good friend. What a very wonderful announcement. And honestly, I can say there are names to every single person of those million people that were mentioned. Each of them has a name. And, you know, I can just think of one person named Sam, who, because of the Canada Child Benefit, was able to be lifted out of homelessness with his 5-year-old. And I think everyone here could probably talk about many, many Sams out there. So thank you very much for that announcement. And now I would like to invite Shay to come up and say a few words on behalf of Pinecrest Queensway. Thank you.
Thank you. Thank you, Honourable Long, for your remarks, your strong remarks, and for your continued investment in the Community Volunteer Income Tax Program. Here at Pinecrest Queensway Health Centre, we know that filing taxes is about much more than the paperwork. For many in our communities, Benefits are tied to filing, yet the process can feel complex and out of reach, especially for seniors, newcomers, people with disabilities, and income families. When people can't file their taxes, they miss out on supports that help them stay housed, fed, and healthy. Last year alone, here at PQ, our Community Volunteer Income Tax Program volunteers supported over 1,000 individuals and families that resulted in more than 3.8 million in tax refunds, unlocking critical benefits like the Canada Child Benefits, GST, HST credits, and disability benefits. Those dollars are not abstract. They mean groceries on the table, they mean medications are filled, they mean rent is paid on time. But like you said, beyond the numbers are stories, and I can give one of my SAM stories. Last year, we supported an individual with nearly a decade of unfiled returns. As you can imagine, once those returns were completed, the refund was life-changing. For the first time, they were able to enroll in post-secondary education and begin planning for a future that once felt very much out of reach. Another community member who had recently experienced homelessness received a refund that helped secure an apartment. It covered essential moving costs and laid the foundation for stability. And because the clinic was free, they didn't have to choose between tax support and basic necessities. Time and time again, we see what begins as a tax return become an entry to stability. That is the power of this program. We are also grateful that this support will continue. Thank you. The renewal of a grant for the next 3 years ensures that our communities can continue to rely on this essential service. At community health centers and resource centers, tax clinics are part of a broader integrated model of care. Income security is a social determinant for health. Filing taxes can often become a gateway to food programs once they come into the building. It can give them access to employment services. It can give them access to system navigation, mental health supports. So on behalf of our CEO, Tamara Chipperfield, our staff, our dedicated volunteers, and the residents we serve, we want to thank you for investing in a program that delivers dignity, stability, and real impact to members of our community.
Thank you very much. And that was Shay Arabuki, who is the Community Development Director here at PQ, what we call Pinecrest Queensway Community Health Center. We just call it PQ because you really are such a part of our community. And also thanks to those that actually run the tax clinic here, making such a difference. So at this point, I would invite Luca to start the media Q&A.
We're going to forego the Q&A. I hope you'll leave your comments, your thoughts on this. Give us a like, follow, and subscribe. And we'll be back. Have a good